Alright, we're looking at chapter 5 now. They did change the title of this chapter just slightly. It's Mental, Behavioral, and Neurodevelopmental Disorders. We're in the letter F, F01 to F99. There's just a couple of guidelines out of this chapter that I want to highlight. The first is dealing with pain with psychological factors, and the next one is looking at psychoactive substance abuse. So when we have pain disorders with patients, if it's exclusively psychological, meaning that basically it's been determined it's all in their head, they have code F45.41. In that case, you don't want to add any sort of code from the G89, which is the pain category, to go with that. And we can take a quick look at those sections in tabular. So here's F45.41, pain disorder exclusively related to psychological factors. Now, if they actually have a documented pain disorder and they also have psychological factors, then we're coding F45.42, pain disorders with related psychological factors, and we can also code from category G89 to indicate a little bit more specifically the type of pain. So here you can see F4542, we have a code also associated with chronic pain, and we get that G89. And we can take a look at that really quickly here. So it's pain not elsewhere classified, but it does get a little bit more specific in that we can document it as acute pain, or chronic pain. We also have neoplasm-related pain, and then chronic pain syndrome. The psychoactive substance abuse, just a couple guidelines here. There are codes for in remission, and again, this just needs to be based on documentation, as is really, that's everything in coding, but especially important in the mental health chapter. And then we also have these terms use, abuse, and dependence that tend to be used a lot. Technically, a physician could use all three of those at the same time. If they're talking about the same substance, they have a few guidelines here. So if they mention use and abuse maybe of alcohol, we're just going to code the abuse. If they say abuse and dependence, we're going to code dependence. Use, abuse, and dependence, we're going to code dependence. Use and dependence, we're going to code dependence. So essentially, if dependence is documented at all, that essentially is the most severe. That's what we're going to code. If it's just abuse with use, then we're going to code it as abuse. If it's just use, then we can code just use. So that's kind of our hierarchy there. And then this last little bit just talks about the fact that we can only code psychoactive substance abuse based on provider documentation, and it must meet the definition of a reportable diagnosis. So it has to in some way affect the patient's stay. We shouldn't be coding it just because we happen to see that it's listed on there somewhere. So there needs to be some sort of mental or behavioral disorder that's occurring from it, and we need a relationship documented by the physician.